Hello and welcome to the Sparked Podcast, Series 2, Episode 5. We'll be talking about aged care today and really digging into the ins and outs, the nitty-gritty of preparing aged care to be ready for digital. My guests are Annette Schmid. Annette is CEO of Digital Health Cooperative Research Centre. She's worked in Australia's health and aged care sectors for over 3 decades and has a deep understanding of the complex policy issues, of which there are a few, facing the provision of these services. Sarah Evans is another guest. She's Senior Product Manager at Telstra Health with 18 years of experience in the health technology space, specifically within the aged care sector. She's got a deep understanding of the issues and pain points, again, of which there are a few, faced by those working in the sector. Having collaborated with aged care facilities and government agencies, she's passionate about solving these problems on behalf of her clients. Throughout her career, she's navigated significant changes in the aged care industry, including 2 funding challenges, the Royal Commission, COVID-19, and the implementation of new and strengthened standards. She's also preparing for the upcoming Aged Care Act, set to take effect on the 1st of July this year. And finally, Adrian Gilliland. Adrian's a GP who's currently chair of the North Coast Primary Healthcare Network, PHN, as well as board member of the Mid-North Coast Division of General Practice. He's previously had advisory positions with the Medical Council of New Zealand, Wellington District Health Board, and Wellington Regional Clinical Board. So welcome all, and we'll dive straight in. Annette, my first question's for you. Aged care, is it digital yet? Big question, but feel free to give us your take.
Thanks, Brett, and I'm absolutely delighted to be here. I don't have a clinical background. My background is economics, so I bring that lens, but I've had a long association with aged care, both in a planning role and in a governance role, and more importantly, having had 2 parents in aged care for a considerable amount of time. I've seen it from many angles. The aged care sector has been under immense pressure to reform across many domains, particularly digital transformation. And that was one of the major recommendations that came out of the Royal Commission. We're seeing data being collected in many ways and formats to provide care for the elderly at home or in residential care. The data is getting collected many times. Our mantra at the Digital Health CRC is that we collect once and use many times, not collect many times and use once, which is what we see is happening. We've all experienced care details are repeated constantly. Sending an aged care resident to ED can be an example of the problem, having gone recently with a piece of paper with hard-to-read handwriting and a plastic bag full of their medications. That's probably an example we don't want to see, but we want to see something much better when we can solve some of these problems that we're going to be talking about today. It's also going to be really important that we connect all those people that sit around and all those professions that sit around the aged care sector, GPs, allied health specialists, hospitals. And there should not be a need to be constantly entering in data and constantly checking on the latest data. Is it digital yet? Well, not quite, but one of the things that we also have to understand is the structure of the aged care sector. The aged care sector is large, 227,000 beds, approximately 260,000 staff. Like many in healthcare, it's made up of a lot of large organisations with thousands of beds and large corporate infrastructure to address some of these coming digital reforms. And then we go to the much smaller groups with minimum corporate infrastructure and scale. That's why a uniform answer is not possible because of that complexity of the aged care sector. I was surprised to read in the last few days that we have 65,000 workforce leave aged care every year. So just think of running a sector where you have that amount of turnover, particularly where you're needing to bring people in to high levels of digital capability. We know aged care providers are supported by 10 to 15 electronic medical record vendors. Many are using anything from 1 to 200 digital services. And a recent survey by the Industry Technology Council identified 287 unique digital solutions supporting clinical care. Many homes are still only implementing Wi-Fi. You can see where the landscape is. And if we're looking at implementing Wi-Fi, that's a pretty basic element if we're looking at getting connectivity and delivering efficiencies that go with digitisation.
Terrific. Thanks, Annette. And yes, you heard it. It's a work in progress. We're not there yet, but we're well on the way. And it does sound like at least the vision has been clarified. So the idea of collecting once, using many times, having connected care, and having the outcomes of quality care provision and transparent activity, but with a sector that is huge, with enormous variation and enormously different levels of maturity. But at least we're defining the path to get there, which sounds like a really significant step forward. Sarah, I'll throw to you. Telstra Health's been a key contributor to the Spark program right from the get-go. From your perspective, tell us a little bit about why standards are so important.
So the standards are really important in aged care, really due to the fact that data needs to be able to flow seamlessly between all of the systems to ensure the information is available. And it needs to ensure that the data is really up to date, and the providers who are using that data really need to be able to have trust and have quality and consistency of information that they're being provided. The standards really help with reforms. The department is recommending SNOMED CT AU, they're recommending AMT for medications, and also FHIR standards as well. So the standards will also ensure the cost of interoperability is reduced. Having to integrate at the moment with every state and federal body, lots of different systems providing data, it's always in different formats, and it means greater cost to the software vendors, which actually some of those costs need to be passed on to the providers, which reduces the ability to become digital for lots of aged care providers. But once everyone's utilising the standards, the costs will go down and the efficiencies will really increase. For healthcare providers in any setting, standards reduce the double data entry, as Annette was talking about. And again, it comes back to the trust and ensuring you have the full picture to help with decision making. And in the end, it really ensures a better clinical outcome for the resident. As you mentioned, Brett, Telstra Health has been an early adopter of FHIR and has been integrating it across its solutions since about 2016. So it really continues to be our direction, and we really want to ensure we are creating a connected digital health ecosystem that supports that seamless exchange of data.
And a follow-up for you, Sarah. What's Spark's going to mean for some of the Telstra Health initiatives?
We really do have a lot of initiatives going on at the moment. Telstra Health's mission is to work towards creating a digital health ecosystem, and the Sparked program really helps to accelerate and support these initiatives. We've been working on AU Core and AU Patient Summary, which is the exchange of the data, including allergies, medications, conditions and immunisations. A few initiatives we're working on include how we might be able to use FHIR to exchange data between aged care and hospitals. We're currently part of the Australian Digital Health Agency in FHIR, building a transfer report which will flow through to My Health Record. So we're able to work with a partner and try and extend an investigation into how we might use FHIR to send this transfer data directly to the hospital system. Another initiative we're looking at is sending progress notes written in the hospital system back into aged care. You might have an aged care resident transfer to hospital, you have all of your transfer documentation inputted directly into the hospital setting. As the hospital is entering progress notes and entering data about the resident, having that information transfer back into the aged care system as possibly a progress note will really help the providers in the aged care setting speak to families, update GPs, update other providers of what's happening to that person in the hospital setting. And then when they transfer back into aged care, you've directly got your hospital transfer data and you're already up to date with the information about the care of the person in that hospital setting. So again, it's making everything seamless. You've got interoperability between the systems and you're also all using the same language if you're using those particular standards in those settings.
It sounds like a really terrific initiative, keeping family up to date in real time or near real time and making sure that those involved in clinical care can see progress is a real boon. Adrian, I'll throw to you. As a GP, you've been present at the table for most Sparked workshops, and I should say we really encourage clinicians to be present. But why is being there in the room such a priority from your perspective?
So it's really important for my day-to-day work as a GP and thinking about also the other GPs within the system and how we also work together better. Within the aged care system, what I see is that it has improved into digitalisation, but what's happening is we're getting lots of disparate systems that don't actually talk to each other. It's actually in some ways got worse since we moved over from paper, because each of us has our own system and paper was a way of transferring data which is read by everybody. And the problem is that now we have to input data into multiple systems, both into our general practice system, into the pharmacy system, so that they can get the prescriptions right, into the aged care prescribing system, and also sometimes into the system that they've got in their own setting. It really works well within the actual individual institutions. So within the aged care facility, within the general practice, within the hospital, it's definitely improved efficiencies. We've been using digital within general practice for over 25 years now. But the problem is when we move from setting to setting, or when we move into general practice into the aged care facility, how do we transfer that information? And that's why these standards in developing interoperability are so key. And also as to why GPs and other clinicians need to be closely involved with developing this work so we get it right and we can actually share the data that we need to share in a way that is useful for the clinicians on the ground. And in the long term, that will improve productivity and make it much easier for all of us to work together.
Terrific. You've spoken to the general challenges of data in aged care in terms of that level of maturity, but are there particular stories that come to mind? Obviously, as a clinician, you know how it plays out and understand the gravity of the consequences sometimes. Is there anything that's front of mind as you consider that?
Transfer of information is essential. Quite often when patients leave hospital, they have investigations done that the results aren't back yet, and we need to follow up on those. They come back to the aged care facility. Nothing has never really happened, and sometimes you can get key sort of results from investigations that don't get through, and that can really have an impact for the person in the aged care centre. I've seen that happen where patients have had a pneumonia diagnosed on chest x-ray. They've been sent home early from hospital because they don't have the beds. And because that X-ray report has not come through in the discharge summary because it wasn't ready, it means the patient has had pneumonia and that was picked up later and they were given antibiotics and actually saved a life as a result of this change. Other areas is particularly where there's lots of different medications summaries, so patients are taken off medications when they're in hospital quite appropriately, but that information doesn't come back to the aged care facility, doesn't come back to the GP, and so these medications are carried on, medications are added, and you get multiple different medication lists which all exist in different systems and they don't talk to each other. And it's essential that we all share the same information about what medications patient should be on based on their most recent encounter and the decisions that have been made.
So it can be hugely frustrating for a clinician.
Not just frustrating, but creates patient safety issues and as I said, can lead to deaths and major incidents from happening. So this is actually really important from a clinical point of view and from a patient safety point of view that we get this right.
And you must feel the weight of responsibility and the need to act. And so when you don't have that information in front of you, how does it play out? Do you end up repeating some of those investigations in order to know what's going on? Or are you picking up the phone and calling around for the right medication list in order to know what to prescribe that day? Because these are time-critical elements.
Yeah, absolutely. We'll often repeat investigations. It's easier to redo a test and try to get the information somewhere else, which is a waste of resources, but it's the most effective way for us to work at the moment. We will ring around to try to get information, but often if it's after hours, and particularly for the aged care facilities, they can't get that information because the pharmacy is closed, the GP is closed, and the hospital doesn't know what's happening. So they end up in hospital because nobody knows what medications they're on. Having this information sharing is key if you really want to know what's happening with the patient and get the best care for the patient.
Thanks, Adrian. Annette, going back to you, digital health CRC, so those cooperative research centres, big Commonwealth-supported public-private research centres, have prioritised aged care. Why is that?
Well, I just think you heard Adrian tell us why, because of all those disconnects, not just from a point of view of the repeated tests and the costs to the sector, but also the potentially poor outcomes from quality point of view. They are the reasons that when we started in 2018 as a CRC, aged care was identified as one of our major industry participants and they were to be a priority. And once again, It was off the back of the Royal Commission as well. 2018, you were sort of in full flight as to what the reality was that aged care providers were dealing with. The need for significant reform, as I said, across many domains. But a key to it, if you can't get the foundations right, or we call it the plumbing, you can't build the house. You have to work on all levels. And for where we were positioned, looking at how we could get some of that plumbing right was a priority. And that project is still a priority and will continue to be a priority. It was called Aged Care Data Compare, and we're just finishing the second stage of that, going into a third stage to test tools in real-world environments in aged care at the industry level to enable that real-time data to be available not just at the point of care for the resident, but at a facility level and then at an organisational level. But like all things, you don't know what you don't know. And when we went into the project with high expectations of an ability to, in the first instance, really look at minimum data set and functional assessment frameworks that could be consistent across the aged care sector. As we now know, we have multiple interpretations of those. And what we wanted to do was use HL7 FHIR standards, so on the technical side, to enable sharing of information across what we would see as data sets that were not necessarily talking to each other. We had high expectations that that would be happening at a more rapid rate. One of the first things that we did was identify across the aged care sector from a clinical point of view, what are those 25 critical assessment indicators? So that was a huge piece of work which will underpin some of the work that we will hopefully see the government mandating at some stage in the near future.
And Sparked as an accelerator is hopefully being part of that acceleration.
Absolutely, absolutely. We've supported it in many ways, joining in all the conversations. And I just, as an aside, having been around the health sector for a while, it's the first time I've seen such a approach to bringing the community together to work on and solve problems together. Because if you're not part of that, you're not going to be in a position to understand why they're being done and how you might then implement them into your workflows and your work practices.
And now it's time for a fun fact from Kate.
Standards are only as strong as their community. Here are some numbers about our Sparked community. Sparked has over 100 founding members and a current community of over 1,100 engaged contributors. Some of the peak bodies involved are the Australian Medical Association, Royal Australian College of General Practice, Royal College of Pathology Australasia, and Allied Health Professionals Australia. To date, 18,000 in-kind expert hours have been delivered by the Sparked community.
And now a question for all, but I might throw to Sarah first. And to Annette's point, why is it so important that the aged care sector aligns its standards or gets its plumbing right with the rest of healthcare?
It's very important. In aged care, we're looking after the most vulnerable, and we need to make sure the information is at hand to make the right decisions. As we've all talked about today, being partners in care and ensuring we have the information and making sure that all of the health ecosystem is available information-wise and includes aged care is really important. The medication discussion is extremely important. Imagine having the visibility of medications from the community when a person comes into respite care. So having that electronically available. When you're in respite care, medications might change. You're going back into the community and the GP having visibility of those changes, as Adrian was talking about. I think making sure that aged care is included in the discussion. You've got allied health, you've got hospital, you've got GPs. It is ensuring those better outcomes for the resident. So having that fully connected suite of data and information is very important. I think the other piece to remember in aged care, and I think Annette mentioned it, you have lots of people moving out of the aged care space. You have lots of different staff that are entering the data using the data. So having standards is really important, and ensuring aged care staff are able to go about their day-to-day without having to do something specific to ensure the right information is given. You should be able to enter data and do your day-to-day work without the thought about where it's going, but you need to trust that it's going to the right person. So having standards really help with that, and the Spark program really ensures that aged care is a part of building the right plumbing.
Adrian, what about your perspectives on that aged care alignment with the healthcare standards?
I think it's essential that aged care is aligned with the healthcare standards amongst the most complex patients that we have in terms of the number of people involved. We've got GPs, pharmacies, the hospital that come in and out of hospital quite frequently. They're very complex patients, and we need to have the data systems talking to each other, because they're on a very long list of medications, many medical problems, many specialists involved. And if we don't get these things right, you're going to get multiple different sources of information that don't match up, and nobody knows what we're supposed to be doing.
Thank you. Annette, it sounds very much like, because aged care is this point of connected care with lots and lots of different players, and as we've heard, reasonable turnover of workforce and a very big and complex space, is that where you think the alignment of standards can simplify things and allow for that more straightforward provision of care?
Absolutely, Brett. That is why we chose the aged care sector, because it is critical because of the way that it feeds back into acute care, community services. So we've got to actually identify that when we talk about aged care now, we're talking about not just residential aged care, but we're talking about care that is being provided at home. You're only going to see that grow. Demands on the residential aged care sector are going to continue to be pressured as all the baby boomers start to hit their 80s, a bit way off yet. We've got to be ready for those changes and how the aged care sector then interfaces with community, primary care and acute care. So all of that requires as much of a seamless journey as possible, and the challenge of not repeating information, repeating tests, and decisions can be made rapidly. I often talk to people in emergency departments, and the time they spend on the phone when an aged care or a resident from aged care has been admitted is particularly around medication management and what tests have been done and what other diagnoses are.
I hear you. I have been that person in the emergency department on the phone for what seems like an interminable period. And you've got personal experience of family who've moved through the aged care system. What would Spark success look like for you in terms of the pathway of care, moving out of different settings according to need?
In that journey with my parents, they moved from low care to high care. We moved through because we had to move them rather than be able to provide that care in place. That's 10, 15 years ago now. From a Sparked point of view, this really is an area where all of the work that's being done with Sparked around minimum data sets, functional assessment, the underpinning elements of that, if implemented well in aged care, will release such value and will be seen so carefully by families who can finally see where they do not have to constantly repeat information, the distress when diagnostics are repeated constantly or the wrong medication is given, right? Aged care is a service that includes often the family, not just the resident. So being able to, as a family member, have access to information in one place would be game-changing.
Adrian, similar perspectives from your point of view, that there are benefits for family, for residents, for those who are caring for residents?
Yeah, absolutely. As a clinician, you always go to the patient first to find out what the right information is. But often patients who are in aged care facility or elderly don't have the cognitive facilities to be able to do that anymore, and you're relying on family members to do that because the data's not there. You need to get information from the hospital, which might not be available, information from their previous GP, information from aged care facility, all of which might be in a paper form or might not be available at all. So it's essential that a family, as well as the aged person undergoing aged care, has got the right information.
Sarah, does that resonate with you? Is that something that seems familiar in the space that you're working in?
Making sure that you've got all of the information as well. So some of the systems that we have available, you might only have a small subset of the information when someone comes back from hospital, or as we've been talking about in the home care sector, not a lot of clinical information is gathered and it is in disparate places. You have to have trust that you've got all of the information, and I think these types of standards gives you that trust in these types of settings. It's all about the best outcome for the aged care person and making sure the right clinical decisions are being made.
In all of the Sparked meetings that I've been in and the great events, there's been a lot of talk about data going with the individual. And so not a case of finding it wherever you are, but having it right with you. It's available, accessible, consistent. And I think we're all speaking from the same song sheet here. Annette, you talked about the turnover of the aged care workforce. How do we make sure that we've got the systems in place for them to be able to navigate as they come on board?
We need to make the data entry constant across a 24-hour cycle, across weekly cycle, all of those things that take up a lot of time. And then you've got the issue with a lot of that data then doesn't talk to each other, so it has to be entered manually onto spreadsheets to feed into the requirements of the Department of Health and Aged Care. So you've got the actual time that people are doing administrative tasks when they came into care for residents. If we could reduce that, that would give them more time to spend with residents and greater job satisfaction. The other issue is, as they often go to other aged care facilities, they are encountering different systems that they may not have been trained on. So eliminating all of those administrative tasks and the time that takes them away from caring for people and doing what they came in for will be a major advance in stabilising that workforce.
Adrian, you'd be in a situation where you go to different aged care facilities. Do you find you take too much time to get your head around new stuff?
So what I'm finding is I'm limiting my scope to only a few aged care facilities that have got the right systems in place and choosing not to attend other aged care facilities as a GP. The amount of compliance that's required, the amount of duplication that you have to do in terms of data entry takes up 2/3 of my time. So actually I need to spend a small amount of time doing actual clinical medicine. Most of the time is doing compliance and data entry in multiple different forms, either in paper, because my system doesn't link with their system, or putting it both into both systems electronically, which completely wastes my time. So a lot of GPs are moving out of aged care just because of the complexity that's required now. And a lot of that could be solved with the right IT solutions and interoperability, which is what we're working on with the standards.
Sarah, you spoke about efficiencies. There's a real opportunity cost here, isn't there? Every moment you're spending on duplication, you're not spending in care provision or something else of high value.
We're hearing a lot from GPs about the different systems that they're having to use across multiple aged care facilities, especially with the introduction of the eNRMC and all of the compliance and the complexities around electronic medication management. And again, the system's not all talking to each other, and just reducing the efficiencies sometimes for GPs when they come in. We also have, coming back to the care workers as well in aged care, a lot of the thought that we put into our products is around looking at icons and ways to easily enter the data rather than having to read a question or read a response, being able to select an icon as they're entering the data in, especially if you've got English as a second language, which makes up a lot of the aged care workforce as well. And coming back to Annette's point around having a lot of people, registered nurses, for example, who've come in to care for residents, spending a lot of their time on admin, which causes frustration in the industry. So doing what we can to reduce that burden, to make sure that the process is seamless. A lot of programs with the government around their systems being able to push the data through as easily as possible from our software to government systems, and also trying to work with the people who are interacting with our software as well, like the GPs, allied health, the staff on the floor, to ensure you get those efficiencies to keep people on the floor, as well as helping to enhance that digital experience for people in aged care.
Fantastic. Responding to the reality of the great diversity of the aged care workforce. Thank you all so much for your time today. I really appreciate your fantastic insights you've given on aged care. The Sparked podcast is brought to you by the Australian Federal Department of Health and Aged Care, CSIRO's Australian eHealth Research Centre, HL7 Australia, and the Australian Digital Health Agency. You can join the community by heading to sparked.csiro.au. And don't forget to join us on LinkedIn at SparkedAU. This show is hosted by me, Brett Sutton, Director of Health and Biosecurity at CSIRO, and produced by Ed Studios' Janine Hamer and Lucy Ratz, and CSIRO's Dr. Naomi Stecklenburg. Sound by Hayley Dell.